Hello everyone. Today's presentation is about mental diseases. Aphorism 210 to 230 describes about the mental diseases. Hope you all know what is a mental disease. It is a one-sided disease. We have already said what is one-sided disease and the management protocol of one-sided diseases. So mental disease is a type of one-sided disease. It's of psoric origin and is not exactly a separate class because all corporeal diseases have altered disposition and mind. According to homeopathic concept, the derangement or disposition or the derangement starts in the field of disposition and mind in every type of diseases. So we cannot exactly differentiate between the mental diseases from physical diseases or corporeal diseases. Corporeal means physical origin. Corporeal means physical body. So it's a one-sided disease. So mental diseases are one-sided diseases of psoric origin, and we cannot separate mental diseases because all corporeal or physical diseases have altered disposition and mind. Now, what is the importance of studying mental diseases? Disposition of the patient often chiefly determines the selection of homeopathic remedy. Another point is that all powerful medicinal agents affects the disposition and mind in the healthy individual who test it. So while drug proving also, we are collecting symptoms of mental disposition. Every medicine affects the mind and disposition in a different manner. But during the proving, we can get a number of different symptoms and signs related to the mind and disposition. But in practice, it is very difficult to elicit mental symptoms from a patient. And we must observe the changes in the state of mind and disposition in every case, even in acute diseases, along with other symptoms. Medicine will not cure if mental symptoms do not match, if it is characteristics. If it is characteristic is very important because I have already said that it's very difficult to elicit mental symptoms in every case of diseases. So if the mental symptom is characteristic, you should have to observe it and taken into consideration that mental symptoms when you are prescribing a medicine, in addition to the similarity of other symptoms. So if mental symptoms are characteristic in a case, then we have to consider that characteristic mental symptom while prescribing the medicine. For example, aconite will not effect cure in patients with quiet, calm, equable disposition. And Naxomica will not be useful if the patient is mild and phlegmatic. Pulsatilla not useful when the patient is happy, gay, and obstinate. And Ignitia when patient is not excitable and calm. And you have studied in Metra Medica under the different medicines regarding their mental dispositions. And it doesn't mean that you always prescribe a medicine based on the mental characteristic or mental disposition. If it is a characteristic symptom, or if you can elicit a characteristic mental symptom in a case, then definitely you should consider that characteristic mental symptom. And you have to avoid also the non-specific mental symptoms. And it is seen that while case taking, you people are writing always a certain symptoms like irritable, does not want to sit alone, or needs company. So all these are certain mental characteristics which are common to every human being. So if there is any characteristic mental symptoms, for example, likewise in case of Nux vomica, that patient is very much irritable to the extent that patient usually throws things while the patient is irritated, like that. So the extent of mental symptoms is very, very important, or the degree of mental symptoms is also very important. So consider the characteristic mental symptoms only. And for example, in a case of pulsatilla patient, pulsatilla is not useful when the patient is happy, gay, and obstinate. And it doesn't mean that you should not prescribe pulsatilla to a patient if the mental symptom do not agree with the pulsatilla medicine. See, pulsatilla is more effective in a case of patient if the mental symptoms are also similar to the pulsatilla remedy. That's only the reason. And I do repeat that you should take the characteristic mental symptoms only while prescribing a medicine or while constructing the totality of a case. Then what is the homeopathic approach in mental diseases? Mental diseases should be cured like any other disease by taking both mental and bodily symptoms, or we can say by taking both mental and physical symptoms. In the beginning itself, it is said that we cannot separate exactly the mental symptoms or the mental diseases from the physical symptoms, because these two things are cordially existing, or these two things are existing together. So whenever there is a physical disease or a physical symptom, there should have been certain mental dispositions or mental symptoms from which the patient is suffering from initially. So we have to consider both mental symptoms and physical symptoms while treating the mental diseases too. Now next is about the different types of mental diseases. So we have 4 types of mental diseases according to Hahnemannian classification, corresponding to the modern classification. Okay, so first variety is known as corporeal origin. Hope you all know what is the word meaning corporeal. Corporeal is physical origin, or the disease starts from the physical plane of the patient. That is known as corporeal origin. In severe corporeal diseases like, for example, suppuration of lungs, deterioration of some important viscous, some diseases of acute character in childbed, it is transformed into insanity or melancholy or into a mania. So here the mental disease is originated because of the physical disease. If the patient or one patient is suffering from a chronic physical illness and gradually the physical illness transformed into mental illness, that is the first variety of corporeal diseases. Mental symptoms act as a palliative to corporeal or physical symptoms. Even after the degeneration into the one-sided psychical plane, the corporeal symptoms become prominent during the lucid interval. So what happens here is that the corporeal symptoms or physical symptoms are gradually transformed into mental sphere, and for the time being, the mental symptoms are more prominent. And during the lucid interval, again, there can be re-emergence of the corporeal symptoms. All right. And the objective symptoms are more important than subjective symptoms. So we have to observe the patient about the mental characteristics, about the behavioral patterns of a patient. Presently we cannot use actually the term mind or mental symptoms, because in psychology you have studied in your first year classes that psychology defines as the characteristic of behavioral pattern. That is actually psychology. So we need that psychological aspect of the patient, how a patient is behaving. That is the observable nature. Behavior is something which can be observed by some other person. That is a behavior. So here actually what we are studying is the behavioral pattern of the individual. Normal behavior, we should know what are the normal behavioral pattern of an individual. Then only we can understand what are the deviations from the normal psychological concept of an individual. Okay, so this mind, what we mentioned in the aphorism, is actually correspond with the behavioral pattern of the individual. And the objective symptom, that's why the objective symptoms are more important than the subjective symptoms. See, a mentally deranged or a psychologically imbalanced person may say that he may have different types of sensations, which we cannot rely upon. So, we have to observe the objective symptoms, the observation, see the behavioral pattern of the individual is to be taken into consideration. So that is the first variety of mental diseases, that is mental diseases of corporeal origin. Here we have to consider both the mental symptoms and the physical symptoms for prescribing our medicine. That is the management plan. And in every type of mental disease, we have already said that there's a soric background. Then the second type of mental disease is insanity or mania. It is caused by fright, vexation, or abuse of spiritual liquors. Actually, it almost always arises from internal sorrow like a flame. So here again we can see the soric miasm in the background of the disease. And it is purely mental. It's not related with the physical symptoms. It is purely mental disease. Treatment should not be immediately treated with antisorics, but first with non-antisoric medicines like aconite, belladonna, stramonium, hyoscyamus, merc, etc., which reverts the sora to latent form where the patient appears as if quite well. Okay, so in the first variety of case, that is the corporeal origin, mental diseases of corporeal origin, we need to prescribe an antisoric medicine according to the symptom similarity, considering both the mental and the physical symptoms of the patient. But in the second type of disease, it is a purely mental disease, or we can otherwise say it as a insanity or mania. And in such cases, we have to address that acute totality of the case with certain acute non-antisoric medicines. And after prescribing or after the patient came to a normalcy, came to a state of normalcy, then we can think about an antisoric medicine to prevent the recurrence of the acute manifestations again. After relief with acute medicine should not be considered as cured. There can be recurrence or reappearance of the symptoms. There you have to follow it with antisoric treatment to eradicate the latent sora, and you should follow the diet and regimen. If antisoric treatment not given, what will happen? Diseases recurs, either become periodic or become continued mental derangement. Now it is difficult to cure by antisorics. So in the case of acute maniac mental diseases, initially you should prescribe acute medicines according to the acute symptomatology of the patient, followed by prescription of an antisoric medicine. Otherwise, the disease will recur or it will lead to a permanent mental derangement. Then it will be very difficult to treat with an antisoric medicine. Now is the third type of mental disease. This is named as the mental diseases of doubtful origin. That means we are in a confusion that whether the disease is originated from the corporeal sphere or from the mental sphere. It's doubtful if they are corporeal origin or results from faults of education, bad practice, correct morals, neglect of the mind, superstition or ignorance. So to differentiate, give sensible, friendly exhortations, that is counseling or psychotherapy. See, if it is of a mental origin itself, then psychotherapy will do something in such cases. But if it is of a corporeal origin, the symptoms will aggravate by giving the psychotherapy. So we are in a confusion here. Real, moral or mental malady, depending on bodily disease, will be speedily aggravated. So this is a type of disease where we don't know whether the disease is originated from the mental sphere exactly or from the physical nature, or it is of a physical nature. So in such cases, the psychotherapy will do better in case of mental origin diseases, or this will aggravate the physical symptoms of the patient. There you need a antisocial medicine, as in the case of first type of mental diseases. Then what about the fourth type of mental diseases? Emotional diseases. By emotional causes like continued anxiety, worry, vexation, wrongs, and frequent occurrence of great fear and fright. This emotional health destroys the corporeal health in time. So this type is presently known as psychosomatic diseases. Psychosomatic diseases. The origin is in the psychic field, and gradually it transformed into a physical illness. The exact opposite of that what we have seen in case of first type of mental diseases, where corporeal diseases are transformed into mental diseases. But in case of the fourth type of mental diseases, here the emotional diseases or the mental or psychological diseases are gradually transformed into physical diseases. So that is otherwise known as psychosomatic diseases in modern terminology. We have a number of examples of psychosomatic diseases. Almost all of the lifestyle diseases have of mental origin, like stress and strain are the causes of majority of lifestyle diseases. For example, hypertension, then diabetes, all this bronchial asthma, all these have a psychological component in the etiology of these diseases. And best time to treat emotional diseases is before corporeal health is damaged. You have to pick it out the emotional imbalance at the very earliest, before corporeal health is damaged. Treated by psychical remedies like display of confidence, friendly exhortations, you can give counseling, sensible advices, and often by a well-disguised deception, etc., can change the patient to healthy mind, plus appropriate diet and regime of the patient. So here is the need of counseling at the initial phase of this emotional diseases before the disease transformed into a corporeal disease. We can give friendly advices, or we can increase the confidence of the patient. All these things can be given by counseling the patient. Then fundamental cause of type 4, the emotional disease, is again psoric myasm. Seemingly cured patients should be subjected to a radical antipsoric treatment. So if the patient seems to be ameliorated from your treatment, again you have to follow the patient with an antipsoric treatment. Then only we can ensure a permanent cure in case of emotional diseases. So in every type of mental diseases, the basic miasm is psora, and we need an antipsoric medicine in case of all these types of diseases, except in purely emotional diseases, where we need only the Psychological treatment at the initial stage of the disease, and then followed by the antipsoric treatment. Then what are the auxiliary mental regime? An appropriate psychical regime towards the patient on the part of bystanders and doctor, not counseling. It's not counseling actually. Example, to furious mania, we must be very calm, fearless and cool. To doleful or sorrowful, querulous lamenting, that is complaining peevishly, we must be very silent and sympathetic in look and gestures. So such type of treatment is needed in handling psychical cases, and these are known as auxiliary mental regime. Then you have to avoid corporeal punishment and torture. Should not torture patients. Even in the administration of medicine, the only circumstance in which forcing is justifiable. The patient should not be compelled or threatened. Medicine should be mixed with patient's drink. You should not compel the patient to take the medicine. And you should administer medicine. You can administer the medicines through the patient's drinks. And so these are certain auxiliary measures that we have to follow in managing psychical diseases. No need for mental consolation or advice to such patients. Psychotherapy, it is useless to type 1 type of cases. Psychotherapy is not needed in case of mental consolation or in type 1 diseases. They must always be treated as though they are reasonable. Because of the corporeal illness, they are suffering from mental disturbances. So you have to consider them as a truly physical disease, this physically diseased patient. But while prescribing your medicine, you have to consider the mental derangements also. Okay. In type 1 diseases. What's there in 6th edition? Violent, insane, maniac, and melancholic are to be taken into a mental institution. If the patient is in a violent state, we have to take the patient to a mental institution and should not be treated in family circle. He concludes the vast superiority of the homeopathic system over other methods in the treatment of mental and emotional diseases of long standing, which originally sprang from corporeal maladies or were developed simultaneously with them. So there is no scope for treating violent mental diseases within the family circle. You should send such patients to mental institutions or mental asylums. So thank you. So we have learned today about the mental diseases. Okay, the definition of mental diseases. It is a one-sided disease of psoric origin, and we have discussed the 4 different types of diseases.